Thank you for watching this video. This video is meant to help you prepare for your surgical procedure and to help answer any of those questions. So the medications that you should discontinue prior to surgery are those that cause any type of blood thinning. So those are going to be things like aspirin, ibuprofen, Aleve, Advil, Motrin, for example. Prior to surgery, you should definitely consider seeing your primary care physician. You want to go through the process of getting your preoperative medical clearance. You want to make sure that you get the appropriate lab work done. And that's going to include basically a panel of labs that include CBC, a chemistry panel, for example. And we also want to check your heart with an EKG. Once all of that is complete, and depending upon your age, then we can go ahead and clear you for surgery. Prior to surgery, it's very important that you stop smoking. You want to stop 6 weeks before surgery as well as 6 weeks after surgery. You also want to be prepared to be using a variety of medications such as mupirocin, which is going to be an ointment that's going to be applied into the nostrils twice a day, basically for the first 5 days before your surgery. That's in preparation to decrease the risk of infections. Other things you should consider are anemia. For example, if you have a low hemoglobin level, you're going to want to talk to your primary care physician about the appropriate treatment for your anemia. And also, you should get prepared in regards to hydration and exercise. You want to make sure that you're well hydrated before your surgery and that you're in the proper exercise regimen. So if anybody has any questions or concerns, our nursing staff is available 24 hours a day. We have a phone that they answer and help patients regarding all types of questions or concerns. That is typically used after your surgery, but if you have questions before, you can always reach out to us at our office. And our main number is 786-804-1603. All right, so in preparation for surgery, what you want to think about are a variety of items that are going to be very important. If we start talking about the supplies, you want to make sure that you're going to have impermeable, basically cloths or impermeable, we call them chucks, which are basically items that you're going to use to cover your bed, cover your recliner, to make sure that you don't get those items wet after surgery. This is especially true when you're getting liposuction done, and really less common when you're getting breast procedures. In general, what you really want to do is also visit your primary care physician. It's very important that you get the preoperative medical clearance done in a timely fashion. And this means getting your laboratory workup, your electrocardiogram to check your heart, and making sure that you get a full history and physical exam. Also, you want to make sure that if you have a history of anemia, which is low hemoglobin levels, that you also discuss this with your primary care physician, as this is critically important to making sure you have a safe and successful surgery. Other important items have to do with your body mass index. So always check, you can check online and see what your height and your weight is, and try to get an idea of where you stand in terms of your weight. You want to be in a body mass index that's ideally maximum 24 to 25, but definitely less than 32. For those patients with body mass index above 32, you're going to have surgery at the hospital, typically with an overnight stay just for your safety. Those less than 32 can have their surgery at our clinic, which is here in South Miami, Florida. Other very important items to consider when preparing for your surgery are that you're going to want to make sure that you have the necessary medications that you're going to need. So we give you prescriptions for all of the important medications the day before your surgery. So please be sure to get those filled immediately after you leave the clinic so that you have access to your pain medication, your antibiotics, any anti-nausea medication. And for those that are having more lengthy procedures, you will be given a prescription for a blood thinner known as Lovenox. And that is very important that you get that filled at the pharmacy. Overall, we just want you to have a fantastic experience. Our nursing staff is always available to help answer questions before your surgery and 24 hours a day after your surgical procedure. So we thank you for viewing this video, and we hope to see you soon.